Well, welcome everyone. Here we are on Wednesday the 17th, and we're going to do another town hall. And this time, for those of you who are out there, the topic is mental health matters. And we're really just going to be talking about why your mental health matters, especially during the midst of the COVID-19 pandemic. What does that mean to each of us on an individual basis, as families, co-workers, as a community? So tonight we are lucky to have once again one of our guests from last week's town hall, Dr. Joseph Lee. And he's going to be joining us, and I'm hoping this one will be a little bit of a conversation. I've got some questions that I'll ask him, and then I really do want to get this one opened up to everybody that's joining in, and let you guys be able to ask questions and see what he has to say. We also have joining us from the Beach City Health District, Lauren Nakano, and so she'll be able to also share some perspectives from the health districts. And also some resources and what we're doing, at least in the beach cities. That's Manhattan Beach, Hermosa Beach, and Redondo Beach. So with that said, welcome, Dr. Lee. Thanks for being here again.
Thanks for having me back.
All right. So let's talk about it. You have a website, a practice. You talk about mental healthiness and you talk about it in terms of how people should just, live their normal day-to-day lives as they go through everything. But here we are in the midst of a pandemic. It's kind of thrown everything out of whack. Normal family interactions, schools are closed. People are working from home or they've lost jobs. I mean, everything has just kind of gone haywire in a really short period of time. And here we are 3 months in, and what's your just, general perspective on like how should people feel during a pandemic, or what is the normal, what are the normal amounts of anxiety or stress that people would feel in this type of scenario?
Right. So I'm a psychiatrist by training, which means I went to medical school, and the specialty I chose was psychiatry. My everyday practice is as a mental health practitioner, and unlike maybe most psychiatrists, I actually have a predominantly psychotherapy practice. So weekend, week out, my day job is that my everyday practice is a therapy practice. So one of the things that I got to experience, which is not typical of a sort of like therapist relationship, is usually, people who kind of do the job I do at some point previously in their own sort of like training or what brought them into the field, there was some work you kind of did on yourself, earlier, and you kind of work through some of your childhood issues, you learned about yourself, and you kind of come into the therapy relationship as someone with some experience to help others. So first and foremost, something pretty unique about my experience in living through this time period is that I was going through it at the exact same time that everyone else was. So a lot of my own experiences of feeling sort of confused and anxious and having my own life flipped upside down and all the adjustments that I had to make on the fly, including, for example, moving my practice from, face-to-face sessions all the way through, I forgot, it was somewhere early in March, face-to-face. I think I sent an email out to my practice on a Wednesday that says, hey, maybe this is coming into our community soon. I'll give you the option. I set up something very quickly to start doing teletherapy sessions. And then by Friday of that week, I think is when we heard about our first case of probably community spread. I think it ended up being like a parent or something at one of our local schools in the South Bay. And then by that Friday night, I composed a new email that said basically, I think because of the evidence of community spread, I switched my whole practice to going online. And so that happened really quickly. And that was around the same time, maybe about a week before the countywide and statewide stay-at-home order. That was around the time when universities and local schools were quickly moving to distance learning. And it was also a time when we didn't have a lot of information, not a lot of reliable information about the coronavirus, how serious it was, how infectious it was. There was a lot of confusing information from different sources. So that was kind of my experience too, just to kind of like give a reference as to what I personally kind of went through. And I think in that sort of kind of understanding that, then I continued to see people, as a therapist, helping people go through this experience also, which was and is anxiety provoking, it's stressful. And so I think maybe in the most practical way to kind of describe what are people supposed to be feeling right now, I think we need to completely acknowledge that nothing is normal about our lives right now. And so it is impossible to actually feel normal. And one of the things that's worth noting is that, most of the time, what we're trying to do in everyday life is we're trying to create a certain degree of security, a certain degree of safety, a certain degree of predictability. And a lot of the people we bring into our lives, the people, the environments in which we work and we send our kids to school or where we live, a lot of those things are built, including where we choose to live here in the South Bay, let's say, the communities we choose to raise our families in or to live. Those are all sort of choices we've made in the long term to try to create a general long-term sense of stability and security. And so I think one of the reasons why life has just been so challenging for everybody is that, as we've been staying at home and our kids are at home with us and we're maybe working from home, or people have lost their jobs, or all these sort of like quick, abrupt, major life changes has happened to either us or people we know, all those sort of anchors of normalcy, including our access to our coping mechanisms, our reliable help, the familiarity of our routines, we don't have access to any of that, really. And so something worth noting is because we don't have access to all those things, everybody is basically improvising their way through life right now. And sometimes if you improvise through life, it works out okay. More often than not, because you're making decisions on the fly, you're working with what you have, but it's not necessarily what you want to be working with. There's also going to be outcomes where things don't turn out so great either. And those can be in big and small ways. And so I think it is normal and expected that life is pretty challenging. And because we spend so much time these days making decisions, trying to solve problems, putting out fires for ourselves and the people that we're responsible to take care of, I think a lot of people are tired too. I think that was definitely my experience. It has been my experience. I know it's what a lot of people talk about, even if they figure out how to get through the day or found some semblance of a new routine. I think a lot of people are tired. And I think there's a certain amount of anxiety and stress that is also somewhat inescapable. So I think most people are feeling that way. They're tired and still kind of persistently stressed at some level.
So how do you differentiate, as an individual out there, right, between what is, say, a normal amount of anxiety versus, something that's unhealthy or would maybe lead one to think I should really be concerned about myself or my loved one that I'm watching have an abnormal amount of anxiety in this time frame.
Right. So in the context as being a therapist and also outside of therapy, another thing I do regularly is I'm a speaker. I talk to parents, teachers, educators, different audiences about social emotional learning, and part of what that is educating people about emotions, what they're for, and so anxiety is one of our core universal human emotions, and like all emotions are signals that we're supposed to be attuned to and pay attention within ourselves that tell us that something's not going right, especially unpleasant emotions, right? And so, for example, just to kind of give a larger conversation about what we should be feeling, we're really familiar with physical internal signals. Like, for example, if we talked about being hungry, we kind of know when we feel that way, we kind of know that there's this, it tells us something. Oh, we haven't eaten, our energy level's getting low. And then we kind of know what to do with that feeling. We're supposed to go get something to eat. There's a different feeling, which is drowsiness. Drowsiness is a different internal feeling that says, you know what, you're tired, you need to sleep, you need to rest. And if you feel hungry, it doesn't help you if you take a nap. And if you're drowsy, you're not supposed to get something to eat, right? You're supposed to kind of like follow a particular script based on what that feeling tells you. So anxiety as one of the emotions that we experience is actually part of a larger system that includes things like hunger, thirst, physical pain, drowsiness, anxiety, as all these other emotions do. And so anxiety, like hunger, is telling us there's a problem and that we should do something very specific about that problem. And so anxiety, if you've kind of heard that sort of familiar, it's a fight or flight response. So, in the same way that having low energy or it's been a long time since you've eaten something triggers a feeling of hunger inside your body, the trigger for anxiety is that we're noticing or we're perceiving something that could be harmful. There's a threat in our immediate environment. And when we perceive that, then we have this like automatic sequence of changes inside our brain, inside our body, that's trying to get us to address that. And that's the fight or flight response. So when we say fight, what that means is once you've kind of understood that there's like this threat or problem in our environment, to fight is to say, I'm going to approach the problem. I'm going to deal with it. I'm going to try to resolve it. And that's actually how my anxiety is going to go away. I'm going to eliminate the problem. And when the problem's eliminated, I no longer have this threat. And then so I'm going to feel relief. And that's how my anxiety ends. If we make a different assessment, though, that says, there's this harmful threat in my environment, and I make an assessment that says, I don't know how to deal with that, or I'm not sure that I have the means or the help or the resources to fix that problem, then that's when we kind of make this other decision, which instead of fight, we choose flight, which is I need to get away from that at a safe distance. I need to get away from the problem. And that's different because it's not really fixing the problem. It's just trying to get a safe distance from the problem. And I think this is relevant, especially if we kind of understand what happened, let's say, very early on as we started becoming aware that this virus was spreading and that we knew it was bad. We heard that people would die. So obviously the outcome is very, very serious. We didn't know enough about it in terms of how you could get it, who could get it. And so in that context, the general sort of overall view was, okay, what do? There's a real threat, fight or flight. And in that situation, we couldn't fight. We couldn't go and fix the problem, make it go away. We didn't have the resources, the information, the tools, the medicine. We didn't have any of that. And then so the idea was, okay, then in this situation, we have to get away at a safe distance. And which is basically what the public health sort of measure to stay at home was about. The challenge when we kind of do fight or flight, and we have to choose flight though, is that basically we know that the threat is still out there. We know that we didn't actually fix it. We didn't resolve it. We couldn't make it go away. And so I think this is why the thing I mentioned earlier, that on some level, even if we're at home, even if we haven't really gone outside, even if we've done all the precautions, even if we washed our hands, worn masks and all these things, we still kind of know it's out there. And so it always makes us sort of cautious. It always makes us feel that anything that we do is kind of, putting us in harm's way. So I think that there's a certain amount of anxiety that, based on what I just described, because the virus is real and it is potentially harmful, and we know more about it today than we did then, but we still don't have treatments. We still don't have things that can sort of really protect us truly from it, or the people that we're living with, or people in our community. So there's a certain level of anxiety that we actually should hold on to be careful, to be cautious, because there's a very real persistent threat in our environment. And for now, we're still kind of doing the flight option, which is to be at a safe distance. So there's a certain amount that I just want to normalize for everybody, that if there's a certain amount of tension or anxiety that we sort of hold on to, but I actually think that that's healthy because it's based on something that's grounded and real in terms of understanding what we're dealing with in the context of this pandemic. That being said, I think there's another sort of more clumsy version that our nervous system and our brain sort of does, which is once we start having multiple stressors pile on top of each other at the same time, unfortunately, what it feels like to us is that, like those layers. So let's say on a scale of 1 to 10, we have a bunch of problems that if we dealt with them one at a time, maybe we could feel pretty comfortable and competent in dealing with them. And let's say on a scale of 1 to 10, these are level 2 problems. The problem or the challenge is if you have 4 level 2 problems happening at the same time, the way it kind of feels in our mind and in our body is that it's like a 6, 7, 8, which on a problem scale would be pretty bad. It would make us feel pretty overwhelmed, helpless. So I think that that's been another real experience for a lot of people. I talked about some of the changes that I had to make very quickly in my own family, my own work, my own practice, and everyone was kind of doing that. So while we were kind of like trying to have an appropriate amount of caution and anxiety regarding the virus that was out here spreading in our community, we also had the stress of sort of figuring out what we're going to do with maybe our kids and setting up sort of distance learning and what our job and our work life would be like, where we were going to get supplies and food. I remember, early on that was actually pretty stressful, not knowing, if we can go to the market or if groceries would get delivered or if you could eat out. Like we didn't know any of these things. And so I think there was definitely a period of time, most of March, I kind of remember it in terms of myself, talking to different people in therapy, that was probably the most overwhelming time for a lot of people because that was when we had all these problems stacking on top of each other. And that was a pretty stressful, anxious time. Since then, I think it's been different for different people. And so I think it's kind of spread out. Some people who have been fortunate where maybe the financial economic side wasn't their biggest worry, maybe breathed a sigh of relief, able to work from home, something like that, got a load off their chest. Some families, once they figured out the distance learning, kids were able to do okay, be independent, get to do their schoolwork, maybe that was okay. Figuring out how to get groceries on a regular basis, what you're going to eat, all those routine and just, okay, that got okay. So I think there was some adjustment as we went from sort of like peak anxiety, which was overwhelming, to maybe lesser amounts over the last couple of months. But that being said, I think one of the other things to recognize now is that it's been really different for different people. Some people are able to manage this. Some people are able to kind of get through it. And for other people, they're really having to weigh what we know are really 3 huge categories of stress in living through this. One is what I just mentioned, the real threat of this virus. Then there's because life is very limited and very different, there's the economic stressors, there's the financial stressors. Those are very real. And for some people, that was almost immediately impactful. And that one felt way more concrete and immediate. And today, to have financial stress than, let's say, a more distant, I don't know anybody who has this virus kind of abstract idea. And then here we are about 3 months into it, and you can kind of see what's going on with a lot of people, which is the psychological sort of burden of being stressed for a really long time, being anxious for a really long time, being isolated for a very long time. So the third big category, you have the virus, you have the financial economics, and then now you kind of have mental health and well-being that's really sort of becoming more and more challenging for more people because we've been isolated for a long time, we've been restricted for a long time, we've been deprived for a long time, that you're starting to see the impact of that. And for some people, again, that's the more immediate. And some people are fortunate where maybe only one category is all they have to worry about because maybe the situation they're in, the other 2 are okay or they've managed. And for some people that are struggling the most, it's all 3 or one of those situations particularly intense or bad. So I think that that's also a big variation in terms of, what's an appropriate amount of anxiety? Why is it overwhelming for some people? Why is it okay for others? I think a lot of it actually more has to do with circumstance.
Mm-hmm. And there's there's so much uncertainty, right?
Mm-hmm.
If you watch the news, going from March or February, right, even up to now, right, there hasn't been a consistent amount of steady information starting at the federal level, right, and working its
Yes.
way down to the local level, right? So I think people become confused when, say, the
Mm-hmm.
president says one thing, the governor's saying another thing, the county's even tighter, and the cities are, like, I think it lends confusion in this scenario, lends itself to people just starting to lose their minds because they don't know who to trust or why to trust them. And they start to question
Mm-hmm.
everything that's coming at them, whether it's through traditional news sources or, as I like to call it, the third part of hell, which is social media, where everything is just a disaster.
Mm-hmm.
You'll see 6 different opinions on one thing in just a quick scroll of Facebook, right? And how do you know? How do you
Yeah.
decipher what you should do? What in your practice and stuff, what do you find, when it comes to media and just consumption of information? How does that exacerbate and or, make it even, how does that totally mess things up for people?
Yeah, the very inconsistent and very unreliable messaging regarding, how bad is it? What's safe to do? What should we avoid? There's been, right, a lot of confusion, a lot of different places where people get their news, because sometimes, for some people, that experience of being so overwhelmed by trying their best to find the reliable information got so frustrating. Some people have just completely disconnected from the news, which is sometimes problematic because things sometimes do change very quickly and people aren't sort of paying attention or aware of what has happened. So that definitely has made this overall sort of 3 months of living through this even more challenging. And I think that, again, here we are 3 months into it, and I think different priorities for different people have started to emerge in terms of what feels like their most immediate suffering. And because of that sort of, here's how I'm suffering the most, and therefore this is my priority, I think that also starting to shift, you kind of see that people are then leaning towards into different sources of information that kind of might reinforce the choices they're already making. Some people are like, I can't stand being at home anymore. It's really stressing me out. I'm worried about my mental health. I've been so isolated. You know what? I just need to go see some people. And then if that's your inclination, it's totally understandable. It's totally valid. Like I said, all 3 areas in terms of like trying to be safe against the virus, the financial stressors, and your mental health. These are all legitimate 3 categories that are all competing, trying to sort of, get us to decide which one of those is a priority. But I think if you're a person who's, let's say, I'm just using it as an example, where your most urgent need is to relieve some, mental suffering, and you've kind of like decided that, it's worth it for me to go outside, go on a date, hang out with my friends. There's a very real human phenomenon, which is confirmation bias, which means that, we tend to look for the information and the data or the research that already supports what decision that we've made, There's a larger sort of phenomenon. There's a larger sort of understanding as to how the human mind works. We like to think of ourselves as human beings as being highly intelligent, highly logical, highly rational. And even though it's true that like the human mind has a very, very high capacity to be smart and solve problems and rational, the reality is human nature, our motivations, what we choose to do, our behavior is still first and foremost driven by our needs and our wants and our beliefs. And then after we kind of make decisions and choices to do things from our needs and our wants and our beliefs, It's only after that we actually start to think about it. Like, this is literally how the sequence of decision making happens in the human mind. We don't actually think first intellectually, rationally, and then come to some decision as to what we're going to do. That's actually literally not how the human mind works. We've already decided based on what we believe, what our most immediate needs and wants are, what our motivations are, and then we will use this super smart human brain to then rationalize and justify and then make sense of the decision we've already made. And I think that also kind of explains why people look for different news sources. People look for different things, why people argue on social media, because what you're really seeing is not people throwing facts at each other. What people are doing is they're sort of publicly working through their own sort of rationalization of the choices that they've already made. And so this is, I think you saw less of this early on, because I think everyone was just kind of like, okay, we'll do this for now. But again, like I said, in the last couple of months, as different priorities have emerged, for different people, then you really start to see this divergence of what people have prioritized, not in terms of just their decisions, but also what people have sort of prioritized as their narrative about like why this is more true and more important, and that's unreliable and untrue, because in some ways this is what it feels like you have to do in order for me to justify my choice to do X. The other ones have to be wrong. But I think at the heart of it, from the get-go, I think what was pretty apparent in just kind of hearing people's stressors. As a therapist, you're talking about what people worry about or concerned about. Even before this all materialized, I think a lot of people like myself in the mental health field, we kind of knew that at some point there was going to be this very challenging reckoning between people's needs to be safe from their physical health, because this virus is very real, but also people's need for security, which is, let's say, manifested in sort of resuming normal life or being able to work and provide for their families, the economics perhaps. And then this third category where even though staying at home from a public health standpoint was a necessary intervention, clearly none of us could truly stay at home for 12 months, 18 months until there was a vaccine, that would be psychologically impossible. So I think there was an awareness pretty early on that all this would come to a head. And I think that also, unfortunately, in this sort of chaotic environment that we find ourselves in, because, it's been hard to have conversations, it's hard to have agreement, it's hard to listen to each other. There's a larger sort of, political climate, disagreement, sort of belief, people walled off in their belief system. Social media tends to kind of exacerbate that because of, the way it's set up and it's sort of dividing algorithms. That kind of was an overlay. And then this just also, unfortunately, becomes another environment where people find ways to disagree and discredit other people. And then it's a terrible time for that to be happening, but you kind of see it play out in these sort of like challenging circumstances where some people are still very much wanting to stay at home and being safe. Other people are out and about, doing more things, with less restrictions. And groups of people are coming at odds, wear a mask, don't wear a mask, for example. That's a very real situation that's happening right now. And because there isn't an ability to come to a consensus in the real world, I think there's a scientific consensus about that, which is wear a mask. I think there's a growing body of evidence that says that, more and more so. But if we're talking about like in the real world, in this community in which we live, it's going to be really hard to get a consensus on that, even if it is, maybe the right thing to do, as an example. And that's been a huge challenge.
So how, I mean, all right, we've had three questions and you've covered a lot of ground, right? But what can people do, right? So you've got an ongoing pandemic, and so many of the things that you talked about in the first question, they're still there. They haven't gone away, right? You've got this kind of this divisive situation happening right now, right? And it's a two-part divisiveness. One being that there's people who feel like, hey, it's okay to just reopen and go out and live life in a normal way, or maybe they're just done with it, as you kind of alluded to. And then there's the people who are still cautious and whatnot. So how do people find resources or best practices for themselves to ensure that they can, not erase the anxiety or the stresses or whatnot, but that they can get through it on a day-to-day basis, and then also, be able to do that with their families, their coworkers, their children. How can people cope in this scenario? What are things people can or should be doing, I guess, to help themselves?
Yeah, that's a huge question.
Yeah. Take your time.
No simple answers. But I will say, okay, so I mentioned that, yes, my day job is I'm a therapist. I'm also going to come from somebody who did go to medical school, somebody who is still a physician and kind of has that background. And so even though it's been a long time, I did, at some point take the biostatistics, can read a medical journal, to take those microbiology classes, know how viruses replicate, how people get sick. Even did a bunch of, work in medicine, in the ward, So from my perspective, and this is also, I think, folds into mental health. I do think a healthy spot, a mentally healthy spot, a physically healthy spot does still need to be grounded as much as we can in what is true, what's accurate, what's authentic, and what's realistic. And so you kind of alluded to it, which is, regardless of the divergence of people's beliefs about what's safe and what's not safe, what's okay to do, what's not okay to do, we really haven't gotten that far away from where we started in terms of there is a pandemic going on. If we look at actual numbers, the literal number of community cases right now is 1,000 times higher, let's say, today than when we first sheltered in place to begin with. So the chance of coming across somebody in the community who's positive but maybe not symptomatic is actually 1,000 times higher. The probability of just coming across somebody like that. And so that's real. And we've learned a certain amount in the last 3 months that maybe people speculated 3 months ago about the virus, that we kind of know pretty clearly now. And we know that you get it mostly by being in the same space at the same time as somebody else who's either symptomatic or is positive and pre-symptomatic. So sharing space with somebody who's symptomatic is the way that almost everyone gets sick. We know that anybody can get sick, but if you got more medical conditions, you're more likely to get severely sick. We know this to be true. We know that in all practical ways, it's airborne. And we know, and this is something I alluded to, is that if everyone wore a mask, that actually would be a huge public health measure that would severely decrease the number of cases in our risk of getting sick, right? So just to kind of start with something like that, why give that information dump? Because I actually think that that's actually part of our anxiety management. Part of our anxiety management is having some sense of what is accurate and true. And we just talked about how hard that is, and I understand that, to sort of get to a consensus as to what that is. But we live in a day and age where, it seems like if different people have differing opinions, then you have to give the same amount of credibility to all differing opinions. But that's not how it actually works. There are things that are more true and things that are less true. And I think, so there's still an effort that I think should be encouraged for everybody to still try to pursue that one endeavor still. As much as we say it's been hard, go out as much as you can. limit your contact with others. It's for you, it's for your community. And that actually really hasn't changed in terms of that general advice. And so that still is true. And like I said earlier, in the last 3 months, medical research and science has produced a certain large volume in the last 3 months that for the most part is pretty consistent about supporting everything that I just kind of said. That's important because then it also then says there's choices that I can make that are safer, and there's choices that I can make that are less risky. And there's something about that does lead us back to what I think is what people genuinely want. People do want to feel safe. People do want to feel like their choices are not just gambles. People want to feel like, I want to know that if I do this, it's going to turn out better. And if I avoid that, it's going to turn out better. So that's one, which is I do think that we need to start from a certain groundedness. In the context of therapy, we actually do a very, very similar thing. Analogy that I like to give is, sometimes people do come into therapy very enthusiastically. They think they know what's going on. They want to work on a certain problem. And then we kind of explore and we talk about certain things, and it turns out that this model or this framework that they had to explain all their life's difficulties might be wrong. And so the analogy I like to give is like, it's admirable if people are putting lots of effort into trying to do something. But sometimes it's like, here's a treasure map, and the treasure's over here, and it's in this upper corner. And it doesn't really matter how hard you try and what tools you have in terms of digging. If you're digging in the wrong spot on the map, you will never find what you're looking for. And so in the context of therapy, we kind of start with what we say is you have to have a reliable insight, meaning that insight you have about like, what is the nature of the problem? What is it that I need to work hard on? What is it that is worth it for me to try to challenge myself to grow, to dig deep, requires, right, that we actually start from the right place. And that's why I'm actually trying to take this time to make the same point, whether we're talking about anxiety management, about living through a pandemic, versus this general model as to how therapy works. It's the same principle that we do need to start from a truthful, grounded, insightful place. Otherwise, it doesn't matter how comfortable we are in putting our time and our energy in other places, we'll never actually get to the outcome we're looking for, right? It doesn't matter how confident people are that they're not going to get the virus. It doesn't matter that people are confident that they don't need to wear a mask. It doesn't mean, like, they could be very, very self-positive in that space. But if that's just not how the virus works, then that person, unfortunately, is putting themselves at risk and other people in the community at risk, right? Versus, there's some grounded, and we can say it, and sometimes in the therapy context, it's the same thing. Yeah, I prefer to do the work of therapy over here because it does feel easier. And unfortunately, the therapist sometimes says, you know what? I understand that's easier, and that's probably why you're picking that. But we need to actually do this super uncomfortable, more difficult, take much longer than you thought it would ever take kind of work. But I can tell you that if we start here, though, and we work through here, this is the only way we're going to get to a safe place, a good place, a healthy place, a growing place, right? And so I think that that's actually an important way to frame this understanding as to why it's worth it to still make the effort to say, what does the science say? What do the experts say? Why should I believe them? How do I find the reliable information? And then from that place, still try to make all these good decisions. And I think if we do that, then we're actually more likely to find some sense of that feeling that's been elusive for a lot of people that have been stressed and anxious for a long time, which is some sense of control, some sense of competency, some sense of security that actually over time will gradually get us to a place of genuinely making some progress, feeling better,
feeling more secure.
Please.
Close the door.
So I think that that's one
Close
important
the door.
starting point, because I didn't want to give any
Close
sort of,
the door,
let's say,
yes.
generic de-stressing strategies without first framing the larger picture, which is we should ground ourselves in something that's very real first, which is that this is a stressful time because the threat, which is where we started, out in the environment during this pandemic is unchanged. It's still out there, so.
Okay, so I'm gonna jump back and forth between you and Warren at this point. So resources or just things that people can do from a self-care perspective during this time. Lauren, do you want to just talk about like what the health district is either doing or thinking about or trying to provide for residents in the beach cities as it relates to taking care of their own mental health during this time, and then Joseph, feel free to jump in and weigh in as well.
Sure. Hi, everybody. It's really nice that folks are focusing on this topic, and I thanks to Christian for elevating it. I think that not from a super clinical point of view, but we know from data, which I think Dr. Lee has talked about, that this community, even as far back as 2017, was struggling. I think in 2017 we were struggling as a nation. There was the Gallup poll that we do for the Blue Zones Project. Data said that no state in the country in 2017 had seen an uptick in well-being. And so I think that, we pre-pandemic, we were already on, a sort of precarious path that I know at the district, Beach Cities Health District, it really struck us and said, what can we do about this? And so from a social emotional health standpoint, started focusing on some of the evidence-based or environmental approaches to working with communities around this. And I think just to add on to what Dr. Lee said, we look at health in a very holistic way. It's not just about what you eat. It's not an exercise. It really has to do with your social health, your connection to your community, even your financial health. If you're living paycheck to paycheck, and we're seeing a lot of that now, the inequities in our community, that those all have a significant impact on people's sense of well-being and their physical health. And so I think that one of the things that we've been looking at since the beginning of the year when we rolled out our mental health and happiness initiative, but also certainly now it's even more relevant, is trying to address the issue of social isolation and loneliness. I think that the alarming stat that I heard is that, I think we can all guess that if folks are in an older population, that they might not have as much of a support system. So that, to us makes sense in terms of vulnerable populations. But college-age students are at risk of being lonely at a really high number. And it was very surprising to us. And so this idea, especially because we've gone through in, almost overnight, we went through this massive change of who we could see and where we could go and, all those things. And so really trying to find, the ways to connect, like, Zoom, I think, has become a phenomenon, really, in terms of that. So trying to find ways to connect with other people, even though it may not be ideal, but it is better than, not connecting at all. And so trying to find solutions, programs. I think people have been unexpectedly surprised that they've connected with, relatives or friends who live far away because, of Zoom, and it makes it, so much easier. So there's, simple things like that. I think the other thing that I'm part of, just having this platform and looking at the issue of mental health and starting to really destigmatize emotional health, knowing that everybody struggles, that it's something that it's it's nothing to be ashamed of. And I think just the upswell of that in our community and really across the country has been very encouraging, to try and normalize, what really is a sort of silent struggle that some people are going through. And then the other part is, and I think to some extent this being in sheltering in place is just to focus on, like, a really be clear. It's become much clearer, at least for me, like what's really important. It's prioritizing what's important to you, to your family. Safety, I think, is of the utmost. Spending time together, things like that. But really lifting up self-care, or being able to downshift and unplug. And Zoom fatigue is real, so it's like finding ways to go out and take a walk or be in nature and things like that. And then the last thing, I think, and Dr. Lee touched on it much more eloquently than I will, but I think it's that sense of control or sense of agency and accountability that probably no other major disaster pandemic has ever had the opportunity where we as individuals can affect the outcome of this this worldwide thing. And so finding the thing that we're willing to do to contribute to that and to feel part of us moving towards a cure or solution, or managing the disease within our own communities, I think is something that the district has been looking at. And so I do have a slide, I can share that later, but of some of the programs that people can join and some of the resources that are available. We've seen a huge increase in our information referral hotline calls. I mean, they've almost doubled. Some of them are calls about testing and things like that, but others are really, significant struggles that people are going through around food security, or, just feeling really unplugged and disconnected from people. And so those are a few things that we've been focusing on in the district.
Joseph, you want to add anything from your perspective, or?
Yeah, I think because, one of the big sort of triggers of feeling emotionally, psychologically down during this time is related to the social isolation. I do think that a particular focus on problem solving, like how do we maintain connectedness with other people, is probably like a higher yield area. Like if you're going to pick an area that says, if I could solve this, if I could make some changes, if I can try to develop some strategies as to how I'm going to try to connect with more people and do maybe meaningful things for other people, I think that's the area that probably will, create sort of more sort of like mental healthiness in the context of this sort of situation, which is challenging. I know in my own practice, as long as this is my 15th year in practice, and for the most part, when the option to do face-to-face therapy was available, which is all the time, that was my super strong preference to do it that way. And given the choice to have somebody come to my office and for us to meet face-to-face, the connection, the reading the body language, and all that stuff is immensely valuable. And in that context, I would strongly prefer that to doing like a session over FaceTime or Skype or something like that. That being said, in this context, though, when that doesn't become an option, and now all sort of my therapy sessions have become like these teletherapy video sort of things, maybe not at first. At first, there still was a lot of me and the person on the other side of the video screen saying, I wish I could just come to the office. And I was like, me too. But I tell you, with enough kind of intention, where now I'm seeing people week after week with the same regularity, we keep the same schedule. And now all of our sessions now for 3 months have been online. It's gotten to the place because you get over the unfamiliarity. And even if the other situation is superior, I think we live in an amazing time where we underestimate the degree to which doing something like this, and it's not quite the same, obviously, but it is still looking at somebody face to face, reading the body language, being able to do something at the same time, there is still a certain degree of connectedness with other people. I think one of the confusing things is now we use this interface for other things that are not necessarily just for hanging out, like work or school and things like that. But I wouldn't underestimate the degree to the intention of trying to make social connections as being a pretty valuable and high yield area that if we can make the effort to consistently try to develop that in this adjusted context, that I think that would actually be a pretty good thing. The other thing about human relationship is it's not just connecting. Positive psychology is this area of psychology research that says that studies well-being. What is it about things that we do as people that create the most pleasure or the most enjoyment or the most meaning? And one of the things that positive psychology says is doing things for other people actually is one of the more fulfilling things that a person can do. And there's reasons for that. I think it's because it creates like a mutual feeling of self-worthiness, meaning if somebody goes out of their way to do something nice for you, you know that they care about you, and that sort of makes you feel good. If you're the person that's doing something for somebody else, then, and you know you've contributed to their well-being, it's an act that says, hey, I made a difference for somebody else. Obviously, like things are pretty limited right now. In terms of like the full range of acts of kindness or gestures that we can do for our neighbors or our friends or people in our community. But I think if we can find creative ways to still, even though we're really talking about our personal mental health and our personal well-being, in the context of relationship, actually it is a personally reinforcing experience to actually do things for another person's well-being. And so finding creative ways to, I don't know, if you're cooking a meal, to drop it off to a neighbor. Lauren mentioned that, we do have vulnerable populations, people who are single, people who are older, specifically maybe thinking about like, hey, if I didn't do this, I don't know if anybody else would. So let me be the person that figures out a way to find these people in my circle or in my community, in my neighborhood, and think of creative ways. I think with a lot of these strategies, because we're trying to develop a consistent sort of habits or behaviors that we can do, I think the intention is we're trying to creatively find ways to meet our own needs and maybe be generous and kind to other people. I think the one thing you want to also think about is, how can you try to do some of these things as a matter of routine? Make it a thing you do on a weekly basis. Make it a thing you do, a few times a week. Because I know this is actually something else that is completely lacking that a lot of people are craving, is in the disruption of our normal lives. And I said earlier, we're all kind of like improvising. I think people underestimate the fatigue that comes from like every day being different. And so in a different way, the more that we can actually create some anchors and reliability and consistency in our sort of like temporary pandemic life. But if we can do certain things on a consistent basis, I think we underestimate the degree to which that also creates some comfort and security and predictability. And if we can even integrate, like I said, some of these things that we know are mentally healthy, like I'm going to make it a point with this group of friends that we're just going to get together at this time every week, and we're just gonna hang out online. I'm going to make it a routine that on Monday, Wednesday, Friday, I'm dropping a meal off to my neighbor because I'm cooking too. Once a week, I'm going to do this other thing, that where I'm going to do this for somebody else in my general community that I know might be lonely, might be isolated. I'm going to reach out, and I'm just going to be a person that checks in with them once a week. And you fold that into your routine as well. And I think that also, to a certain degree, serves meeting one of our own needs for predictability, for security, for control, over how we live our lives. And I think that also does something with this decision fatigue that we're all feeling. When you're improvising your way through day after day after day, I think, we hit a wall at some point, or we're just like, we don't want to make any choices. And unfortunately, oftentimes that's when we're vulnerable to being impulsive, when you've hit that point of decision fatigue. So So that's another sort of thing that's worth practicing, which is it's worth it to try to create some routines, into everyday life, even now, even if this feels temporary. It's pretty important to do that as well.
Okay. So why don't we do this? Why don't we open it up to questions? I see we have other therapists and MFTs that are joining us, school administrators. How I know everybody probably has worked enough in Zoom, but just in case, at the bottom of your window, you should see a thing that says participants. If you click on that, it'll fly out a window to the right side. And usually there's a little icon that says raise hand. So if you want to ask a question, just raise your hand, and I can call on you. If that doesn't seem to work, then just wave wildly at the camera, and I will call on you physically that way, and then just unmute yourself and talk. So, anybody. Okay, Michelle Charfen.
Okay. Hey, Joseph.
Hi.
You can hear me okay?
Yeah.
Okay. So I guess I have a question about addressing kind of like the fatigue that people have about being isolated now and this desire to return to normal life when, like you said, the reality of the situation is we're still in the middle of a pandemic with about 1,000 times the community spread we had at the beginning. And I'm just wondering if you have advice as to how to hold those conversations with people or try to help people to still understand that when what they're really wanting is to not feel anxious anymore and to have things be normal. Because I realize even myself, after as a healthcare provider and having many conversations like this over the past few weeks with people, I'm sensing so much fatigue. It seems like people just want to do what they want to do and they don't want to think about it anymore. And I even find myself getting to where I'm like, is it even worthy of having these conversations anymore, of actually trying to explain what the risk is and what's still going on? And so I'm wondering if you have any advice on that as far as for like just allowing people to put priority of like my mental health and having fun up here and stop talking about it, or is it still worthy of having these conversations, and how would you advise to have them? I hope that question makes sense. If it doesn't, let me know.
Yeah, it makes sense, and it's a very challenging conversation. I think what's happening, though, to kind of, it makes sense that people are kind of at the end of their rope, and so I would completely validate that oftentimes these decisions that people are making are not necessarily because, like, they're truly wanting to be completely reckless, but I think that desire to just reach for normalcy does come from a lot of places. It comes from anxiety, it comes from fatigue, it comes from feeling bad for a long time, feeling deprived for a long time. And so all those feelings are completely understandable. I feel them too. I'm sure most people are feeling that, going through this together for 3 months or so. So I think one of the challenges is that, you want to be validating and saying, look, I get it. I also want things to be normal. I'm also exhausted and tired. I just want to do X, Y, and Z, which was like the favorite part of my boring life before all this happened. So I think one is to be validating. And two, I think when we're kind of in that emotional space where any emotion kind of maybe is at the upper limit of those feelings, it actually does affect our thinking. I said this earlier, which is that, we kind of like consult our intelligence last, even though we like to think of human beings as being primarily intelligent. It's actually like the last thing we do. We think last. And so our thinking is highly swayed by our emotional state at the time. So I think one of the valuable things to do in the context of if you're trying to have a persuasive conversation with somebody like that, to try to change their mind, is I think you do kind of want to help them dial down the emotion a little bit first. And sometimes just validating and saying, I get that, that's hard, and I'm struggling with that too, and I can totally relate, might accomplish that. And then I think if we can get someone to a sort of space where they're still obviously feeling what they're feeling, which again is real and valid, And then maybe a little bit of sort of the challenge that says, well, what if it wasn't either or? What if I completely understand your desire to do something that resembles normal life, but could we be careful still, though? Is there a way to do that with caution? Is there a way that we're not saying, and I think these are the more difficult, right? The most polarized conversations, right? When someone is like, I'm going to go out because the virus is a hoax, right? That's a pretty extreme sort of, let's say, version of that conversation. Versus a person says, I'm going to go out because I can't take it. And even if they imply, I don't care if I get the coronavirus, I'm just so sick of this. Okay, that's all right. So if you dial down the emotion with some validation, give them some space, let them vent. And then maybe in the moment where it's, 30% less intense, then the challenge is sort of like, I hear you. Is there a way for you to maybe do that, though, that kind of still is as safe as possible? I think one of the other, this goes back to something Christian said about like the challenges of receiving reliable information, including, let's say, from public health. One of the challenges is like, if the public health department basically says at this point, you shouldn't be having any gatherings and everyone should remain, have social distancing, then those public health officials aren't allowed to actually release guidelines that say, but we know you're going to break the rules anyways, so here's some reliable scientific information as to how we can minimize those risks. I think practically as physicians, I'm sure you're in the spot, I end up having these conversations with people where we have the more real conversations like, listen, I know realistically from what you're telling me that you're not going to really stay at home for another 6 months with no social contact. But then we can have the conversation that's not necessarily like, don't do this, don't do that. But I think there has to be some space to have some conversations that says, if you're going to do this, this is a safer way to do this. Try to do that, right? And I think, as a physician, we would tell people things like, try to do things outside if you're going to do that. Try to, wear a mask as much as possible. Why don't you start off with a brief visit, first and not make it too long, see how it goes. I think, when we're doing emotional reasoning and emotional decision making, which again is a vulnerability from being tired and fatigued and fed up and deprived. So we're very vulnerable to that kind of decision making. We tend to think in either or, black and white, all or nothing. And I think the space we're trying to get to is to have these conversations are probably more realistic and more pragmatic, that kind of says, but if you're going to do something like that, and then I think people would be more willing to listen. I'll tell you that in the last 3-4 weeks, right? I mean, this is kind of the trends that you kind of, maybe if you have 30 conversations a week with people in the context of therapy, you get really in tune with what people are thinking and feeling at different times. And in the last 3 weeks, I definitely say that that's been the conversations, right? A lot more people are like, screw it, I'm just going to do this. I'm just going to go. I'm just going to hang out with my friends. I'm just going to go to the beach. I'm just going to go, go to that secret restaurant in the South Bay that's been open for 3 weeks and nobody talks about it. I'm just going to do these things. In my experiences in those sessions, if you validate, you tell people that it makes sense that they feel that way, that feeling that way and wanting to do that makes perfect sense, then there's some room to kind of say, okay, but maybe could you, and then we try to talk about things like exercise caution. And I'll tell you that more often than not, in the last 3 weeks, a lot of it is just containment, risk management, harm reduction, we probably would say in the context of medicine or psychotherapy, harm reduction. It becomes the strategy. I'd say more often than not, people are like, okay, I'll try that for this week. And if they do it, I think people find that in this present context, doing a little bit of something normal actually becomes gratifying enough to get them to hold on for another, period of time where they can exercise more caution and patience. And I think that that's become more realistic as to what our goals have become now, which is to help support our communities through this little by little, and so Still challenging for sure, but I think that that's how I would approach it. That is the type of conversation I have with a lot of people. These are frequent conversations that are happening in the context of therapy.
Thanks, I appreciate it.
Anyone else? All right, well, then I'll go back to my questions. So, all right, Joseph, I have a question here. Like, what can family members do if a loved one has passed away or been hospitalized during this time? What are effective coping mechanisms for dealing with that kind of challenge? You know, where especially parents, you know, maybe who you're isolating from because they shouldn't be around, you know, younger kids or people in general due to medical conditions.
Mm-hmm. Did you say the first part of that again? Like, what's the question again?
Yeah, it was what kind of advice or coping mechanisms can you pass along for people who have loved ones that have either passed away during this time or they've been hospitalized, so they haven't been able to have that intimate connection that you normally would, right? And then I just extended that further to, you know, parents or family members that are elderly or, you know, susceptible to illness, you know, and so there's that isolation from them as well.
First and foremost, I would say that scenario where somebody is in the hospital or somebody has died and family has not been able to be there in the normal way that you would typically if this wasn't in the middle of the pandemic, it was some other medical illness, it was an accident or some other health problem. So this particular situation, and this has definitely happened, that situation is like the worst. So first and foremost, I just need to frame that, right? In terms of like, what is a terrible, horrible, hurtful, emotionally devastating situation that a person can find themselves in? It would be that. It would be that a loved one has died and I wasn't there and I wasn't allowed to be there. I couldn't be there. And I would say that is first and foremost, you know, to bracket it and frame it in the context of, okay, let's just acknowledge that situation is uniquely bad, uniquely difficult, uniquely challenging, uniquely hurtful. And so I think if we frame it that way, I think we're first and foremost saying like that is going to be hard. That is going to be challenging. And it makes sense if people have experienced that is one of the more emotionally and relationally difficult experiences that they've had to go through, you know, to experience them. Not just the death of a loved one, but the death of a loved one from a distance without being able to do the normal things to comfort, to be present for your own grief. I think that, you know, oftentimes when people experience the loss of a loved one, you know, it is genuinely easier if it's, let's say, somebody you had a great relationship with, they've lived a long, fulfilling life, they've then finally passed away from natural causes at, 97, family was all there, they had a beautiful funeral. Let's put that as, let's say, the gold standard, as even though we all have to face death eventually, that's the situation where you would say, okay, that grief is the one that maybe people would be able to process in the most healthy, natural way. And anything that's different from that, and it would be somebody dies from an accident, a child passes away before a parent. These are these kind of like life experiences that are genuinely really difficult. They are genuinely things that people probably need unique and sometimes professional help and support with. And I think sometimes it's just important to say that I think that this scenario that you've just described is something that over the course of, working through all the eventual sort of bad situations and repercussions of living through this global pandemic, that situation is going to be one of those situations that I think a lot of people are going to experience. unfortunately. And I do think that having unique grief groups, maybe considering going to psychotherapy, having a professional sort of work with a person through that is important. I think sometimes that's one of the things we do when we do education, and we try to destigmatize mental health, and we talk about, different situations and different scenarios. Sometimes it's just important to normalize to people that there are certain life experiences that aren't meant to be experienced alone. And there are certain really hard life losses that probably even, if you're a healthy, strong, emotional person, still is too much for one person to just try to power through and get through it by themselves. And so my thought would be that, as you described that situation, is I think that's a situation where help and support to come around would be very necessary, and would be good. And I wouldn't hesitate to sort of encourage that almost immediately, because that's complex grief. That's a complicated grief situation. It's not typical, and it'd be challenging. So, that's my answer, to just validate how uniquely difficult that is, getting professional help and specific, grief groups and things that are oriented for this, that exist for complicated grief, to act as support for people going through these types of unique situations is important.
Yeah. I saw a hand raised by Nick, but then the hand went down. Nick, did you have a question, or? Okay. Well then, all right. So how about kids? What can we do for our... Oh, wait, hold on. Nick's hand went back up again, so let's just check. Nick, did you have a question? You can unmute yourself and ask it if you want, or I can unmute you.
Yeah, I did.
Okay.
It's actually Nick's wife, Brittany.
Oh, hi, Brittany.
My question was more of, kind of going along with what Michelle was talking about, but, for me, I have asthma, so, things have been more difficult because of that. So, dealing with it as a person that has, an additional issue has been really hard. Especially, when we go on walks or, we drive around and you see people walking into places and just not using masks, or all these stupid YouTubers that are on, in other places, that it's hard to, see an end, or, when I'm going to be able to go out and feel comfortable, because am I going to be able to, trust other people? And I could do all the things I want, and, I could wear a mask, my husband could wear a mask and everything, but it's more of, everybody else out there. And, I haven't gone out, I've only received deliveries, I've made my husband work from home, and those kind of things.
Mm-hmm.
I mean, it's not really a question, I don't know. It's more of, how do you deal with that, and the anxiety of it, and when you listen to the head of public health and saying people with asthma should not leave their houses until the end of summer, that was a month ago. So, I guess it's more of, how do I go from here, kind of thing.
Mm-hmm. I guess it makes me want to ask a few questions, but without going into too much detail, I'll try to maybe answer a little bit more broadly.
Yeah, I was going to get that emotional, so.
Yeah. I don't know if you've recognized the pattern of what I feel like a lot of what I'm doing as a therapist in the context of the last few months for a lot of people is just literally telling people that you struggling and having that emotion and feeling the way you feel makes more sense and is completely valid and understandable to kind of feel the way you feel than anything else, really. And so sharing what you share and feeling what you feel and the frustration and the anxiety in your voice. Look, it just makes sense that of course you're feeling that way, because the situation is it is generally more difficult for some people than others. And I think that has been one of the larger challenges and tragedies of this, which is it's hard for everybody, but I definitely understand that it's harder for some people in different situations. And having a pre-existing health condition is genuinely a higher risk. And in some ways, yes, a public official is doing their job by telling people, hey, if you got asthma, you got to stay home longer than everybody else. But that's a hard thing to take in when obviously it's been already very hard to do it for as long as you have. There's this other idea in the context of certain therapies we call radical acceptance, which is this idea that as difficult as it is sometimes to speak certain hard truths, it's important to acknowledge that they are true. And radical acceptance is this idea that says, if we can speak the truth and acknowledge things like, wow, this is a really crappy situation. My situation was worse than other people's. This is really hard. I don't know what I'm really going to do moving forward. But being able to speak that is actually, in many ways, the beginning of an effort to be actually more effective in trying to make incremental, meaningful changes from that starting point. It goes back to something I said earlier about, before any real solutions can happen in the context of working with people emotionally or psychologically, our first effort as therapists often is to get people to that place of saying, what is the most truthful truth of what are we dealing with here? What is the situation? How bad is it? How did this happen? And we're trying to get to an authentic insight. And as difficult as that process is to speak it, to admit it, to share it, to emote it, it is an important place because it's actually from that place that people start to get better. It's from that place that you're able to finally start making some true meaningful progress. And so we call that radical acceptance because it's this radical, crazy idea just to say like, okay, it is what it is. Not in a defeated way, but just to kind of like acknowledge this is where we're at. And so from that place, you can make a more concerted and direct effort to try to make things better. I think the other thing that's worth considering is, something else that I said earlier, which is especially when we get into these emotionally heightened states, and misery and anxiety and frustration and disappointment are all dial down the emotion 20-30%, and then we can try to pull from a little bit more of our problem solving, critical thinking place. Sometimes our small resolutions, like, okay, maybe I won't be able to walk a lot because people outside aren't wearing their masks, but maybe if I could take short walks frequently with my husband, but I do it more frequently. I do it every day. Let's see if that works in terms of changing things up for me enough. I think the trap becomes nobody's wearing a mask, therefore I can't go outside until this is all over. I think that in itself reinforces a certain internal sense of helplessness, which obviously doesn't help. But I think that's the hope that, if there's small increments, small solutions, and you build on them, I do actually think that accumulates and it adds up. And those small sort of benefits, incrementally kind of chip away at the degree in which you might feel frustrated or anxious or hopeless. So that was very much a therapist's answer.
Thank you, Brittany, for your question and sharing.
Yeah, thank you.
Anyone else? All right, I'll go. So, Joseph, kids, right? How
Yeah.
you've got kids, I've got kids, everybody has probably gotten way more intimate and more time to actually be with their kids in this scenario. And so I think there's been a lot of blessings that have actually come out of as a result of this. But how do you help support the kids? Because they get used to routine. They need consistency and routine in one way. And so, when it initially happened, I'm sure it was incredibly disruptive for them on one hand. On the other hand, it also may have been extremely positive because they maybe have more family time and connection that they wouldn't normally get, right, as they're going off to school. But how do we support kids just in general, but also how do we support kids as they maybe are trying to cope through the stresses or the anxiety? What's the difference, say, between what we're doing for ourselves and what we do for them?
I think in my experience, what the kids are struggling with most is not being able to see their friends. Kids are highly social. It's a big part of their maturity, their growth, their pleasure, their fun is spending time with friends, doing things with other people. And so I know that that's been definitely something that kids are probably most aware of in terms of feeling disconnected from their peers. And I think at least in my household, and I think in a lot of maybe other households, very similarly, at least in the short term, been trying to have the kids stay connected with their friends in different ways too, technology-wise, FaceTime. My daughter's figured out a way to kind of like set up her iPad and play with her friend, like they have a setup over there and they have a setup over there. I think kids are pretty adaptable and resilient. They're developmentally changing a lot anyways. And so I think maybe for them, even though we're completely acknowledging and recognizing that they are probably deprived of certain activities and socialization, I don't know that it's actually as worrisome for kids at this moment in time as it might be as parents projecting more worries on their kids, So I think that's one thing. Two is, I know school just ended in most places, and if it wasn't already done, I think one of the things that was good and was shared to a lot of parents was to change their expectations about what school normally is versus what school was supposed to be in the context of distance learning, which is clearly not the same. And I think that for kids, it's important to kind of be probably more in tune now to kind of what exactly their differing needs are. I think school maybe ending is going to be a bit of a transition for families, because even though distance learning clearly was very different than dropping your kids off at school and then being there all day and then picking them up, school was sort of like in some ways the structured remnant of normal life for kids, even though, again, the application of it was quite different. And so I think there's a bit of a transition that a lot of families are going through right now, that in the absence of the structure and the expectation that having school and meeting with their class and their teachers have provided, even if it was so different than normal school, it was still providing a lot of needs in the sense of structure, expectation, routine, boundaries. So my advice a little bit for families in terms of paying attention to their kids right now, knowing that school's over, is to kind of be open and flexible as to what is good enough in terms of what their activities are going to be over the course of the summer, leaning way on the side of letting them do creative play, fun play, outdoor, backyard play. Philosophically, I come from a different place regarding education, that I think play is education. Kids spending time being bored, working on projects, building things, learning things on their own, develops self-motivation, critical thinking, that is more broadly applied eventually in life than whatever it is that they're making in front of them. So, I think if kids were, to be honest, just kind of given a lot of free time this summer, including the opportunity to get bored and find things to do, and maybe given some projects that they can work on, I don't think that would be the worst summer for any kid, to be honest. Again, from the context of freedom and self-motivation and self-directed learning and play and creativity. Might not have the normal formalities of what is sort of a typical sort of kid summer, junior guards, camps, activities and sports and things like that. And I know a lot of those things are not available this summer in the South Bay. But again, just to kind of open up the expectations that the kids are probably going to, for the most part, be all right, and I think as parents, if we can kind of some boundaries, but probably more freedom and openness than we're typically used to giving them, this summer, at least if we're just talking about the summer and school ending, I don't think it's going to be the worst thing.
Okay. I see former mayor of Hermosa Beach, George Box, has raised his hand. George, you want to unmute yourself? Go ahead.
Thank you, Christian and Dr. Lee and Laura. Nice to see you guys again. I just want to share some experiences that I've had, and I'm taking this seriously. I believe we are in a global pandemic, but I have friends of mine that they're smarter than I am. They have a higher education level than I am. Retired CEOs, for example, or one CEO. And I think all of you have heard it, blown out of proportion. And when I start questioning them, the CEO, for example, he says, George, just Google it, research it. Every year there's a percentage of people that die with cancer, with heart disease, and other diseases. And if you Google it now, you'll see that number is real low, and the COVID number is real high. So he questions, why is that? I have a friend of mine that refuses to wear a mask. He's waiting to be actually arrested because he thinks he's going to make a lot of money, because he does a lot of surveys and data work for government and big companies. And he says, I've seen all the data, George. These masks, they're worthless. They don't do anything. And I'm not going to have somebody tell me I have to wear a mask. And when he stopped and they said, you can't enter this store without a mask. I have a medical condition that doesn't allow me to wear this mask. And they can't ask, he says, for a doctor's letter because they can't ask that question. So what does he do? They don't stop him. He goes in. I was at a local grocery store. Everybody had their mask on. And this friend that, he's not a real close friend. I've known him for years. I've known his father passed away. And I asked him, why aren't you wearing your mask? And we're in line ready to be checked out. And he just out loud says, it's nothing but a bunch of BS. And then I have friends that are taking it very seriously. And then when I tell these people, well, it's not just us. This is a global pandemic. What about the rest of the world? And then they say, well, do you realize that 80% of the deaths due to COVID is because of elderly people, underlying conditions in nursing homes? Locking down this country like they did and we still are locked down, opening up slowly, was all political. Now, these people believe all this stuff. There's one person that I'm going to refer to you, Dr. Lee, that has a good job at El Camino. He's a teacher, and he can't deal with this for all the reasons everybody has shared here and you have shared. So his neighbor doesn't want to have to deal with him because he's afraid he might, that he's too reckless and he doesn't want to be exposed. So I invite him over to my house, but in the backyard, where social distancing, and to have a beer and a cocktail. And I'm not a professional therapist, but, you know, I've had in my past anxiety attacks. I've had depression, and I'm doing well now, but this is when I was younger. And so I'm listening to him and sharing, you know, my experiences, and I think it helps him a little bit. And, you know, he says the same thing. He says, I called him today to listen, to join the town hall, and he's down in Orange County. What are you doing down there? He says, I'm in a bar down here. I think I might be moving out of LA County and go to Orange County. Of course, you see some of those cities, you know, they don't want to wear a mask. And so I don't know if it's appropriate for me to share all this, but I mean, I think a lot of you have heard the same things, right?
Yes.
And, you know, let's face it, and people are on, you know, have different political positions. And and if you talk to the hard, you know, people on the right, the hardcore on the right, well, this is just the Democrats doing all this because they're trying to defeat Trump, you know, in November. And but I'm taking it seriously, believe me.
Well, I'm glad you are, George.
I wear my mask, and of course I have to take it off when I'm eating. But so I don't know if I've contributed anything or not.
I just wanted to make sure, George, if there was a question, you know, that you wanted to pose.
Yeah, well, the question is, I guess, I don't know if this guy will see you or not.
Mm.
What advice can you give me to deal with these people when they say, well, look, do your own research, George. Oh, listen, this even gets one better. I didn't write anything down. I went to one business. I'm not going to mention the name. It's a, I guess you might call it a homeopathic type business, right? And so I'm explaining to the owner what's going on, and this owner says, George, just do the research. You know what this is all about? It's Bill Gates. He's going to benefit from the next virus, vaccine. And then a younger person, a lady was leaving, overheard me talking, and she going to her car after buying some products and said, and she's right, George. And if you want me to text you and send you the information, I will. So this is what's going on all over the place. Mm-hmm. Anyway, how should I deal with these people? I don't get upset with them.
I think every version of a person you described, I think is a person that we've come across, and some of those people are in our families, in our friend groups, in our acquaintances. I think that's a very common sort of experience. Some of those very specific things that you've said, that people have said, are being widely shared. And I'll tell you, it's challenging. I think it's related to something I said earlier, which is, I think, this larger thing about human nature, which is because we think that we're intelligent, and we're not which is what is more true, driven by our wants and our needs and our beliefs, we actually think that because we have an explanation, or we say things like, you can do the research, or we say things like, I've done the research, that we actually think that that's how we came to this place where we believe what we believe, because it is based on science, it's based on fact, or research, or YouTube video I watched, or something like that. It's a very humbling thing to kind of admit as a human being that me, you, anybody, most of the time we do illogical, irrational, self-centered things all the time. It's just that most of the time when we do that, it doesn't contribute to a global pandemic. And I think that's actually the unique, frustrating, the really frustrating thing is, you can have friends, and we all have, normally, who have beliefs that are very different than us. Some of their ideas are completely irrational and crazy. They believe it, but those beliefs aren't necessarily somehow harmful to us or maybe harmful to other people. At least we don't think it is. In this particular situation, somebody follows through on this sort of belief that it's all a hoax. Bill Gates wants to implant microchips in all of us, or all these sort of stories that are circulating. The problem with that is, then like you said, I'm in Trader Joe's, everyone's wearing a mask, he's not. This is a problem. Brittany said earlier, she's got real medical issues. All these people that are not believing this and are believing that it's a hoax or whatever Democratic conspiracy, prevent her from being able to leave her house for another month, And so there's these real consequences. And that's obviously really, really frustrating. I think, there's a lot of details in there. One of the things is when they say that everyone needs to wear a mask, the research suggests that about 80 to 90% of people get to wear masks. So you know what? If 10 to 20% of the whole population never wears a mask for all sorts of reasons, but we can get 80% of people to do it, to believe it, and to do it universally, it'll actually be good enough. So just practically, that's one thing that's worth kind of being reassured about a little bit. It doesn't actually have to be every single person in order for that to work. Most of the studies say about if 80% or more people wear masks, it's good enough. It'll help. It'll stop a second wave. It'll stop a third wave. I think there's a certain reality, and this is, again, not a great answer, but there's a lot of people that are very incentivized because, again, it's not based on intelligence or education or logic. People are incentivized to believe certain things. And depending on the intensity of that incentive, that motivation to believe what they believe, it's very unlikely then that unless you get to their motivation and incentive, that you will ever be able to persuade someone based on an argument, right? The argument is the red herring. When they say things like, do research, I've done the research, that's actually not, again, like I said, that's not how that person arrives at that belief. It has nothing to do with their education, their intelligence, or things like that. It has to do with their motivation. If there's any shot, especially if you have a relationship with these people, if there's any shot of getting them to reconsider, it won't be through persuasion relative to their argument. It won't be through persuasion of saying well, I got different research. I'm just telling you that that's not going to ever be the path. It's going to be leveraging your relationship. It's going to be sort of saying, but if you do that, I just can't see you. And that hurts me, or that bothers me, that it'd be like that. For my sake, even if you think it's foolish, if we hang out, for my sake, we'd be willing to wear a mask. If there's a chance. You'd have to approach it from a more relational, emotional, motivational place. And maybe that's the best advice I could give you, to say to not get caught up in any attempts to make an argument, to appeal to somebody's intellect or their rationality, because actually that has nothing to do with why they believe what they believe.
Thanks for the question, George. Brittany, I see Brittany and Michelle have their hands up. So, Brittany, you want to unmute and go ahead.
Hi, it's actually Nick this time.
Oh, okay. Well, hi, Nick.
Hello. So I do feel the same way as Brittany and George, getting frustrated with people not following all the protocol, especially because my wife is high risk. But I actually have a much different question, just about kind of our country in general. Do you think there's a reason why our country seems to be doing so much worse than others? Is it like a cultural thing, or is it leadership? I mean, obviously the leadership has not been a united front, and I think that was a big factor, but do you think even if we had good leadership, we'd be in a similar position? And is there anything we can even do about it now, or are we just too far past?
Is that question for Joseph? Or, yeah.
I have an opinion on that. I don't know if it's within the scope of.
Yeah, I guess it's kind of for both of you. I mean, in a cultural way, I don't know if you could speak from that way.
Yeah, actually, I could speak, and if I could actually speak from a cultural standpoint, and this is something indirectly when I speak in other contexts I do talk about. It was I think one of the reasons I was invited to contribute last week when we were talking about race and policing, which is being Asian American is a bicultural life, right? Meaning that I have grown up embodied in myself two worldviews. My parents were immigrants, and but I was born here and I've grown up my whole life in Southern California, so I am very much Americanized, right? But I'm actually both. I'm not neither fully like of one culture or the other one. And I think one of the unique things of actually having a bit of a sort of like lived experience of being Asian American is that you actually have internalized this understanding that there are very different ways in which people understand the world. And one of these ways that you become aware of is that in most of the world, and actually Europe and America is the exception, that most of the world has a collectivist view, which means that it is more normal for people to form their self-identity in the context of understanding how they connect and relate to other people, their family, their culture, their community, their country, their history. All of that becomes a very normal way of understanding yourself and who you are. And that's actually, even though people assign that to, let's say, Asian cultures, that's actually every culture other than, for the most part, European cultures and America. America and Europe is influenced by a individualistic culture. There's reasons for this, philosophically, after the Middle Ages, Dark Ages, just kind of the way that Western thought developed. But individualism is something that feels very familiar if you've grown up in America, which is my self-identity is me, my motivations, my talents, what makes me special, my rights, things like that. And so if you say an idea like to a group that intuitively, naturally understands collectivism, that my well-being and my identity is connected to the group that I belong to, and you say something like, in order to get through this, we're all going to have to wear a mask. And that's not really for me, that's for all of us. That is something that is just easier to internalize if you come from a collectivist culture and a collectivist perspective. If you say that same idea, and this is, I think, the challenging early rejection of, let's say we're talking about masks in particular, masks have always been a public health sort of measure, meaning it's for the community. And I think the initial rejection of masks was people said things like, research says that masks don't prevent me from getting coronavirus. Therefore, masks aren't useful. That is actually kind of true that that's what mask research says, that it doesn't prevent me from getting it. But if everybody else wore a mask and I wore a mask, then the evidence is actually overwhelming that in hospitals and in countries that have implemented masking and, all sorts of computer models, they all say that if everyone wore a mask, right? But again, that's a group choice, not an individual choice. Everyone in the group has to do it. So, there actually is very much like this sort of difference. And again, sometimes you have to be someone who comes from a different perspective to be able to see something, right? And I think that that's sometimes just something we talk about, when we have a race-based sort of orientation or a cultural perspective, or like in my case, a bicultural perspective, is that you're able to see something, not from an intellectual sort of abstract level, but like I can see that the way that my parents think and the family I grew up in terms of what makes sense as to how the world works and how we relate to each other and how we're all connected naturally to one culture feels very different than American culture. And American culture is actually even a more hyper-distilled version of individualistic thinking than even in Europe. And so I think there is something very specific about American subculture influenced by this very sort of like naturally, what feels like a natural orientation to be very individualistic, to follow public health recommendations. I think that that's actually an unfortunate vulnerability. And how does that play out? It plays out that people have a hard time making choices for the cumulative health of their communities. And I don't know if that's something that people can be persuaded from, because like I said, that's a natural feeling for a lot of people, that, the way that a person ought to be is, to see themselves as an individual more than they are as part of a collective. And again, not everyone thinks that way.
And I would just say, from my perspective, Nick, I think when you're an elected official, even at the local level, people continue to come to you with questions, and you want to be able to provide answers. And when there is not a consistent message that is coming from, say, all levels of government, and in this case, the inconsistency has primarily been coming out of the president's office, right? That makes it super challenging, because then people start to question, well, who's right and who's wrong? And I'm not a physician or an epidemiologist, right? So I'm trying to share the data and the information that's being presented to me. And I'm not really in a space where I'm going to get into a political argument, because I don't feel like a pandemic should be a right or a left or a blue or a red, issue. It's a scientific issue, and I really don't think that there's a good case for argument to express, as Joseph was just saying, your own individual philosophies as to what you think is or is not. So has that been frustrating? Yes, it's been frustrating for me personally, and I'm sure it's frustrating for a lot of people. And I don't think we always have to agree on the way we're going to go about things, and that's one of the beautiful things about our country, right? Each of the states has their own ability or inability to deal with it in the way they want. But the inconsistency of messaging or dissemination of information and facts is key to us actually all kind of rowing in the same direction, and ideally pulling through the pandemic sooner than later, without experiencing a drastic second or third wave. So hope between Joseph and I we answered your question. Michelle, did you still have your hand up? Yeah, go ahead.
Yeah, so I have another question. This is for Lauren, I think, and Joseph. So I know that Beach City Health Districts does a lot of preventive health and public health outreach work, and I'm wondering if there's been I haven't looked already a lot into what you guys have done, but I'm wondering if there's been outreach or public messaging about wearing masks, or if there's been any talk about campaigns to try to actually help to make that something that's more socially acceptable. Campaigns about, like as Joseph was just addressing, that is not something you're doing just for yourself, but that you're doing it for the whole community. I don't know if that's anything that's been discussed at all already at the level of Beach City Health Districts, or if it's something that you think could be helpful to discuss. And Joseph, if you could weigh in on that also. I mean, ultimately, we can really only affect our community around us, right? I mean, everyone's trying to affect everybody, and we don't have stuff coming from the federal level. And I'm just wondering, actually, from a public health measure, Lauren, what kind of stuff you guys have talked about as far as for trying to help affect the behavior of people in some of those kind of harm reduction strategy type of ways that were brought up before.
Yeah, I think it's every day, every week, new direction and guidance is coming down. I think we've been really clear, like, we followed the CDC, because CDC actually does have some stuff that's been coming out that sort of has laid the groundwork for then the state and the county. We know that the state is what is permissible and the county is what's allowed. So we've been following what the county has been putting out, and every week, sort of reams of things are coming out. So I think for us, it's about distilling down what's the most current information and trying to make that as accessible to businesses that are trying to reopen and the public. And the last couple weeks of just getting barraged about testing questions and clarity about that. And, there's a lot, it's so nuanced too. I think that it's really hard for people to figure it out. And I think that the mask thing and some of the protocols, it's just this sort of moving target with public sentiment. We have some new stuff coming out. I think we've been trying to, and this goes back to something that Joseph said earlier. It's like trying to make it personal. It is about what we do individually, but we're doing it for other people. And I think the thing that's occurred to us about this pandemic is that, we have the already known vulnerable populations of people that, are living alone, that might be older, things like that. But the definition of vulnerable population has, exponentially increased with this pandemic. And, people like I have high cholesterol, like people with chronic health conditions that may not even self-identify as that, are walking, in the world. And I really appreciated Brittany's question and her share, because there are lots of people that I appreciate that she identifies and is trying to keep herself safe. There's lots of people who are out in the world who may not even feel like they're sort of in that category now. And so we have been participating on what's called a JIC. It's a Joint Information Center. So it's a regional group of the cities, the school districts, a lot of other agencies where they're really trying to get coordinated around unified messaging. And I think the mask thing is still in conversation. We, all collectively have tried different approaches, but very open to, new ideas that people have about how to, what would resonate with people and motivate them, to do and maybe perhaps act in a different way. So it's very challenging, but important.
I'll say this, Lauren and I have had more conversations about changing behaviors in the beach cities around a whole variety of topics than I would ever care to admit. But Joseph, did you want to expand on that or no? And it's okay if you don't.
With how to persuade public sentiment. Again, probably. Well, we kind of said what we're up against and why people are resistant. I think, this is never the thing that we want to choose. But I think in medicine, in certain issues, in mental health, we talk about harm reduction. And harm reduction is a difficult idea because harm reduction means it's going to be bad. We're just trying to make it less bad. Mm-hmm. And I think if we kind of lean into the reality that, the whole country's approach at this point is harm reduction, this is not going to be contained, right? And it goes back to that other idea and the radical acceptance of that idea. That being said, like I said earlier, if we can radically accept that harm reduction is now our best goal, which is that we're going to have bad outcomes, so we're just trying to minimize it, then you can try to really say things like, our harm reduction strategy with masks is 80%. We're just trying to get 4 out of 5 people to do it because that's our real threshold. And sometimes in a harm reduction strategy, because again, you expect losses, sometimes you have to do these things. And this is why I think people struggle with harm reduction, which is that you choose certain bad outcomes to happen because you know that it's more worthwhile to do other things. And so, maybe this even connects to the other question earlier, which is, do we try to convince people who will never wear a mask to wear a mask? No, we just don't. And we try to get every other person who's willing to do it to do it as easily as possible. And then we try anyone who might be on the fence to leverage them into doing it. And our goal is to get to 80%, because again, that's what we really need. We don't need 100%. And if 20% of the population will swear to their grave that, it's a conspiracy and the rest of us are foolish, but we actually get to 80%, then we'll have been successful, because that's what matters, right? And so I think sometimes that, like, if we're talking about practical, pragmatic, realistic world strategies, you could build a campaign around, like, 80% is okay. like this, and you might be more realistic in getting there, right? And then I think framing it that way also means, like, I don't need to convince everyone. I don't need to convince every single in my group of friends. I need 80% of the people in the store, 80% of the people in the street, 80% of people, in schools, 80% of like that becomes the goal. And maybe that's actually attainable, like, to try to get to that level than it is otherwise.
Pat Healy, did I see your hand raised or no? Just checking before we kind of wrap it up, but I thought I saw somebody mention that your hand was up, so.
Yeah. Sorry. Hello?
Yeah, we can hear me. Yes, we can.
Hear me? Okay, wait a minute. Can you hear me?
Yes, sir.
Oh, I'm sorry. Let's see. What concerned me is the way that people talk about this. Like, for instance, they say that they're in quarantine when they really are not in quarantine. They're asked to be self-quarantined, but you know what I mean? It's like quarantine is completely different level of isolation. You can't go to the store. You can't go out for a walk when you're in quarantine. They also say that they're in lockdown, but if you were in lockdown, you could not go to the store. You could not go to the beach. You couldn't, you know what I mean? So the way that people talk about this is kind of interesting. I learned that people are rather terrified to be alone, which I thought was kind of interesting. I've seen people that are that their whole identity was built into their job, and when that job was removed, they had a really difficult time with themselves, trying to figure out where their life is right now. It's like because they weren't used to that. So that was kind of unnerving. People had this feeling that they were imprisoned in their homes, which I find really strange. We live in Redondo Beach. Let's see. Last night, the mayor was talking about things opening up, kind of Pollyannaism. Maybe things are getting really. But I see no data that supports that these things are leveling off at all. I mean, we've seen spikes in California in communities where we weren't seeing spikes before. Let's see. The restrictions are in place, but I don't see anybody. I mean, I see very few people down at the beach wearing masks and practicing social distancing. So I mean, I'm just. These are some of the things that have sort of been, I've been sort of like statistically, okay, let's look at it this way. We had Kensington, right? Kensington was giving us some great numbers because they tested all of their patients, they tested all of their personnel, but they were getting hassled to the point where they had to actually withdraw from giving the people, us, what's going on in that facility. Okay. And then now I want to contrast that with Sunrise, where my mother is. We found out that my mother has been in an assisted living center and has only been tested after 5 months, and it was only because she ended up in the hospital with a respiratory condition. And so the management was telling us oh, well, we have 0 patients that have tested positive for COVID. And I'm going and I challenged them, I go, and that's because you don't test. And he said, yes, that's true. We don't test. They don't test either their employees nor their patients, So and here we were getting some really solid data in Kensington, and you can make a plan when you have solid data, and then when you have no data at all, you get a completely false picture. So I kind of feel for people like Christian and people that are in positions of authority that are trying to make a difference here, keep people informed. Because there are people that actually challenge Christians, saying, "Why are you doing this? Why are you talking about COVID?" Because they want to move on. I mean, but it's ridiculous. This thing is we haven't even begun to level out the first wave. So I mean, that's just my thing. Okay. Thank you.
Okay? No question. All right. So before we close out here, Lauren, do you want to share your screen and just share some of the resources that the health district has, just so people can see it? And then will you also put those resources up on the BCHD either website or social media, just in case people want to reference it?
You let me share.
Oh yes. Let's see. Okay, I think you should be able to now.
Yeah.
Okay.
So there's we have several different kinds of programs that are going on. We found that we were talking earlier about parents, especially with young children, and in working with a lot of our city partners and employee wellness programs, this idea of a place for parents to be able to share and just kind of talk about what's going on and some of the challenges and some of the silver linings of that. We just started a happiness chat on every Tuesday in June. So it's just a forum where people can connect, where they can talk about topics of the day. We have a really fun mental health and happiness series going on. That the next 2 that we have on Saturdays are about cultivating bravery and reaffirming purpose. And I think some of what Joseph talked about in terms of people's really getting clear about what's important to them and having a sense of agency are those 2 topics. Will cover that. And then we have a monthly drop in where people can just do a 30-minute meditation. I think some of the practices around meditation and things like that are definitely seeing a resurgence, because it's a way for folks to build a practice and a coping skill. And then we have a bunch of stuff on our website, which is here. And then also, if people are really struggling, we have some of the hotline numbers there as well. And then another one I just wanted to share is our information referral line. It's the one I talked about earlier. You can call pretty much about anything. We have a social work staff that will answer the live phone. It's now 24/7, 8:30 to 5 every day. And so, just welcome people if you have questions, if you need resources, if you're just looking for something, you're welcome to call that line and access a live person to talk to. So.
And for the first slide that you showed, if somebody wants to join any of those virtually, do they just go to the BCHD website and
right.
the links are there for them to join in?
Yeah, and they're all done by Zoom now, so we'll just you can register, and then we'll send you the Zoom link for that actual event. So
okay,
yeah,
great.
Welcome anyone who'd like to join.
Thank you for sharing, and thank you for being here, Joseph. Any parting words before we close it out?
Just encourage people that I think the questions were great. I think in the context of being a therapist while living through this myself. I know that there's been different waves of experience and priorities and feelings. Like a lot of people have kind of mentioned, and I believe too, that this will continue for quite some time. And so I think finding support, finding temporary normalcy, reaching out for help, and I appreciate the resources provided, and I'm glad that we have such resources in our community. It's great. The general plug that says, you don't have to be hitting rock bottom in order to seek mental health treatment with a therapist. Now, one of the interesting things about all therapists moving online is that the available therapists are probably just anyone who's licensed in California. It doesn't actually have to be somebody in the city in which we live in. And so there is, in some ways, an accessibility sort of openness that previously didn't exist, and that's a good thing. So reaching out for help is a normal human thing. We are going through uniquely challenging times, and it's going to be some time. So I encourage people, if they need help, to seek help. And so, yeah.
Well, thank you. Everybody give Joseph a virtual round of applause, and Lauren, thank you very much. I truly appreciate you participating both this week and last week. And we'll be having other conversations. As a matter of fact, I think we'll be having future town halls even on the topic of racism and some of the stuff we were talking about last week. So that conversation is going to be ongoing. But thanks everyone for participating tonight. Stay safe, wear a mask, and remember it's about protecting everyone else, not just yourself. Thanks so much.